My name is Amber Jones. I am a co-coordinator for the Southeast PTTC, and I am thrilled to be able to introduce today's topic. It's sustaining prevention programs, demonstrating impact to strengthen funding and community support. And we are joined by Dr. Drew Reynolds, and we are just thrilled to be able to bring him back. He has presented for us several times, and he is a really amazing human and also great presenter. So thank you for being here, Dr. Reynolds.
Thanks, Amber.
Yeah, of course. I am not going to read the acknowledgments, but I did want to highlight that the opinions expressed in today's presentations are the view of the authors, and they do not necessarily reflect the official position of DHHS and SAMHSA. All right, so we are the Southeast PTTC, and we are in a network of centers across the United States. I'm going to show you a map here in just a moment, but we provide training in TA to the prevention fields, the substance use prevention fields. So here is a map. I know many of you are familiar with us, and if you are not, we're so glad you're here. We are at the Southeast. We are Region 4, and we have the Southeast State, and we are housed at Wake Forest University School of Medicine, and we are led by Drs. Wolfson and Wagner. All right, a little housekeeping. We do provide certificates for our webinars, and you will be able to receive this certificate if you are in need after you fill out our evaluation form. And even if you don't need a certificate, please take the time to fill out our evaluation form. Our feedback is very much appreciated, and we use it to help plan and make things better the next time around. So I'm going to repeat that one more time because it's our most asked question. Will you receive a certificate? Yes, you will receive a certificate. At the end of today's presentation, we will put a QR code and a link to be able to fill out the evaluation form. The biggest thing here is to please pause, because after you fill out the evaluation form, it a lot of times says it's going to take you to an external site. That is legit, and that's where your certificate is. If you have any issues, please don't hesitate to reach out to us, and then we can help you. All right, well, again, it's my honor to give things over to Dr. Reynolds. He is the principal consultant at Common Good Data, and I'm going to go ahead and hand it over to you, Dr. Reynolds.
All right, thank you so much, Amber. Well, it's a pleasure to see you all today, and thanks for the opportunity to share, I think, an increasingly important topic for many organizations, which is trying to wrestle with this question, of course, of funding. We're always interested in trying to, how can our organizations obtain the funding that we need? But to do so, I think we're going to think about that through the lens of impact. And it's so important to be able to kind of figure out how you can demonstrate and provide good, credible evidence that what you're doing is having an important impact on the community, and that you're able to then speak and talk about that in meaningful ways. So I'll go ahead and pull up my slides here and we'll get started. All right. So the title today is Sustaining Prevention Programs, Demonstrating Impact to Strengthen Funding and Community Support. And you'll see that there's a link down here to commongooddata.com/prevention. And we'll have that dropped in the chat here as well, so you'll be able to see it. I'll go ahead and drop one in here real quick too, so that way you can access that link. On that link, you're going to have a ton of resources that we're going to use today, including a scorecard. So go ahead and click that link, take the scorecard as we get started. So on this website, you'll see 3 buttons. One of them is take the scorecard. Start there. We'll use the other resources later. There's the slides if you need them, as well as a handout that we'll be talking about. But this scorecard is the Behavioral Health Clarity Impact and Funding Resilience Scorecard. And it takes about 5 minutes, 10 minutes if you spend a lot of time on it. But you can do it pretty quickly. And I'm asking you to complete that at the start of this presentation, because what we're going to do is take that scorecard and your results from that scorecard and be able to use that as the driver of our conversation today. That's going to look about the degree to which your organization, from your perspective, right, has that sense of clarity over what you do, the things that you are trying to accomplish, the outcomes that you want to take on. From impact perspective, the ability that you have to gather the evidence needed to be able to demonstrate impact of the work you're doing. And then lastly, turning that into a connection around funding. So again, go to www.commongooddata.com/prevention, and then click on that first button that says take the scorecard. And I'll let you all take that as we kind of get started with our presentation today. And I'll walk through a few things so you can kind of listen to me a little bit as you're taking the scorecard. I think you guys can multitask. I think you can pull it off. So we'll give that a shot. So again, see the link in the chat, commongooddata.com/prevention. You can also use the QR code there as well and do it on a phone if you'd like. Okay, so as Amber shared as an introduction, my name is Drew Reynolds. I'm principal consultant at Common Good Data. My background is in social work. I've been a social worker my whole life. Been in academia. I've been in practicing social work as well. And for the last 8+ years, I've been doing consulting with organizations to really help them find more strategic ways to examine their data and their impact, to conduct rigorous evaluations of the work that they accomplish, and then in turn use that information, not just for maybe an internal learning or for a PDF of a report that sits on a file somewhere, but actually use that information in ways to drive that organization forward, whether that's making new decisions around programming and services, trying to find ways to expand services to meet new needs that arise, or finding other ways to kind of engage and connect with stakeholders and funders. And it's that last piece that we're going to spend a lot of time talking about today. So I love doing this work and really appreciate the opportunity that I've had to work with many organizations, specifically in the realm of prevention, which is what we're all here to do today. Many of you have connections to prevention one way or another. So check it all out in there. Amy mentions that the scorecard doesn't list all the states. Oh no, just go ahead and put Georgia if you didn't know what state to do. Just put Georgia. Sorry about that. I didn't realize I didn't have all 50 states in there, so we'll go ahead and change that. So thank you for mentioning that, folks. Sorry about that issue. Just put Georgia as your state if you cannot say which state, and we'll let you go through. As kind of talking through some of those pieces around demonstrating impact and securing funding, I find that many prevention organizations continue to run into this challenge because many of you, whether you're receiving federal or state funding, are trying to find new ways to continue to support your work. And some of the traditional funding streams have changed a little bit. Certainly, we've had changes at the federal level in terms of priorities. That's also happened in some places at the state level as well. And so prevention organizations are starting to wonder, how do I now position my organization to be able to be attractive to those existing funding resources so that we can continue to do the work and in some cases do it in new ways, to be able to try some different things. And that's really going to be the focus of our conversation today, which I think should resonate with many of the challenges that you all are experiencing day to day in the work that you're doing. Alrighty. Let's go ahead here and I'll click on objectives. And let's talk a little about what we're going to do today. So first, what we're going to do is identify and assess some challenges in data and evaluation work. And our work with the scorecard is really going to help with that. And as you go through it, you'll be able to see some of the things that we'll be talking about today and give you a chance to reflect a little bit on what that looks like. All right. And then also we're going to talk about 3 core kind of concepts that are associated with this funding score called Clarity, Impact, and Funding. And so Clarity is going to be thinking a little bit broadly about kind of what it is you do and what it is you're trying to accomplish, and being laser focused on what that is, and being able to say that with clarity and with confidence, and to know that in and out. And many of you probably have a good sense of who you are and what you do, but this provides a new opportunity to kind of revisit that conversation in new ways to kind of open up conversations for maybe some opportunities for innovation. We're also going to talk a little bit about this impact. So how do we then demonstrate impact in meaningful ways? And while there's a lot of kind of technical things you can do in the world of data and evaluation to demonstrate impact, we're not going to go into all those pieces today. But what we are going to do is focus a little bit conceptually about what does impact look like and what does it mean to shift a perspective from outputs to outcomes, and to do that in a meaningful way in a prevention context. And then what we're going to do is also develop this framework for using impact to communicate your value. And this is one piece that I think is oftentimes missing with organizations that I've worked with, is that you might be good at gathering some, or having a sense of who you are, and maybe even you're pretty good at gathering some data and even some outcome data. but then it sort of feels like it's done. Maybe you submit it in a report to a funder, you send it to a grant officer at the federal level, or maybe a contact you have in your state. And then you feel like, okay, I'm done. I've met the requirement of my grant, and you move on to continue with your work. And what I want to encourage you to do is to realize there is such incredible value in the impact and outcomes that you have. And if we can take that information and kind of repackage it or talk about it or use it in ways to communicate the value of your organization, it'll give you an opportunity to start to not only support and continue to steward your existing sources of funding, but also solicit new ones. And so we'll talk a little bit about what that looks like. All right. So what's our challenge here, right? What's our challenge? So what I'd like to do, I know I'm giving you guys so many different tasks to do. Many of you are still completing that scorecard, so thank you for all the work that you're doing to put that together. But what I'd like to do is to start off is to spend a little time talking a little bit about your biggest challenges in communicating impact and securing funding. So in either of those two or together, what are your biggest challenges in communicating impact and securing funding? As you're thinking about your response to this question, go ahead and drop it into the chat. And we'll take a little bit of time to just get a sense from folks in the room. What are some of the biggest challenges you're experiencing trying to communicate that impact and share that in a meaningful way with funders and others who would support your work? It could be that I've given you all too much to do here between the scorecard and things in the chat. We got a couple here too. So let's start off with Lori. Lori mentions securing continual funding to support strategies that are working. I think this is a really important concept, right? Because a lot of times we're in work where we might have a project that is time limited. Maybe there's a new grant opportunity and it's a 1-year grant, a 3-year grant, or a 5-year grant. And what happens is that you take on that new grant funding, and then all of a sudden you've been doing this great work that has been going for multiple years. And all of a sudden the community sees you doing it and starts to count on you for doing it. And you want to find additional support to keep it going, but that grant period is ending, right? So Lori, thank you for mentioning that, is this need to find continual funding to support existing work. Not everything has to be brand new. Not everything you're doing has to meet some new grant requirement. And I think that as we talk about that clarity piece and getting really clear on what you do and what you do well, positions you to be more effective in obtaining that kind of clear and consistent, continuous funding to support your work. Derek mentions data. Absolutely. That's a huge challenge for many organizations. And it can be more challenging now. We're in an environment where, communities can be a bit more skeptical about data. They might say, I'm not really sure if I'm interested in filling out your survey. You might be one of those people yourselves who's felt like I've taken too many surveys in life, or I've been a part of too many focus groups, and I'm a little skeptical that I need to be able to participate here. And that can be one of those big challenges, is trying to find that information and that data that you need. And we do have some really great national sources of data in prevention. And some states have good sort of state level data, but we're finding that that's becoming a bit more fragmented, and it's more difficult for organizations, especially I think where I'm located in the Southeast and the clients that I've worked with, to be able to obtain that data, especially when it comes to prevention and youth, and how do we sort of gather that information, collaborating with schools and others to gather things like core measures data or others. Jill mentions sustainability, right? So we kind of talked about that a little bit earlier. How do we maintain that continuous funding for the work that you do? And some of you may be block grant recipients or some other sources of funding that might be a little bit more stable than others. But the reality is that it's never really fully enough to do all that you think you're capable of doing and all that your community fully needs. So how do we find some of those more longer term sustainable areas of funding? And I'll talk in the end of this presentation as we go into this kind of impact conversation. It's trying to have such clarity around the impact that you're having and have such knowledge in your community that you begin to be seen as the go-to entity for that particular challenge or problem that you're set out to solve. And the more you become known in the community for the work that you do, and not just among the professionals who know you, not just among the people who are already prevention people, but beyond that, it helps you to be able to be that known entity that can then gather the diverse set of funding resources needed to maintain that kind of continuous work. Finding community partners is on here. This is great. Funders like instant gratification, so it's hard to answer long-term outputs and outcomes. That's very true. It's kind of like, all right, we did a grant, and what did you do in 1 year, right? And in the prevention work, when you're working on these upstream kind of public health values, you're really kind of building a future that is going to be determined 10, 20 years down the road, right? That's the impact of what you're having. So it can be sometimes challenging. Now, I do think that there are some shorter term outcomes that you can kind of hang your hat on that can make a huge difference for the work you do. But I think that's a great point to be bringing up. Risk factor data or negative trends are downward, which is amazing, but funders see it as a problem solved. Oh, this is so important, right? Because if you look at trend data for, let's say, alcohol use over the course of our lifetimes, for everyone on this call, I don't need to date anybody, but if I go back to when I was in high school or when my parents were in high school, it's been a steadily decline in terms of alcohol use, 30-day alcohol use among youth. And so you might say, hey, problem solved, right? The challenge is that there's still many youth who are using substances, right? And so what we have to do is try to figure out, how do we position that next level change, right? And how do we kind of think about it and communicate that in meaningful ways? And I think that we'll give some examples later on around things like, for example, the impact that substance use has on students' academic outcomes, on mental health outcomes. We have connections we have between underage alcohol use and other things like car accidents. And as we kind of talk a little bit more about some of the challenging impacts that substance use can have on youth, we can try to, I think, re-highlight the importance of continuing this work, even if we see an overall trend downward in a positive direction. Wendy says data to show that what you're doing is working, right? And I think that that's one of the most important things is how can we show that, hey, you ran this great prevention program, or you did a positive social norms campaign. Maybe you have a community coalition that has launched a new advocacy initiative around a particular topic, or maybe a policy change in your community around a tobacco ordinance, for example. How do we then show population level change as a result of an action of one organization? That's one of the biggest challenges that prevention organizations face. And I think, again, it comes down to this question of positioning. How do you kind of position that impact and outcome and connect it for people in sometimes unconventional ways? We sometimes think in terms of like problem, program, solution. But if we can think a bit more expansively about that, so that we can recognize that it's one piece, a part of a broad array of services that your organization has been advocating for and connecting, and that over the long term, we see these broad changes is kind of a way to think about it. Marcy mentioned it's with rural areas in mind, serving large demographic or geographic areas with limited staff. That's a huge challenge, right? So many of you probably have lots of receipts or documentation for the mileage you have when you have to drive from one county to another county to another to be able to serve your community. And when you have these large expanses, it's harder to develop those kind of close and trusted relationships needed to deliver the services. I also think it's particularly challenging for some local communities in rural areas who might not have the kind of capacity that maybe some urban areas do at a county level to be able to have access to things like data, local data around prevention initiatives too. I will say though, Marcy, that I have found though that in rural areas that the close-knit communities and people who know each other, those kind of relationships can sometimes be a really good opportunity to be able to kind of push past some of those barriers, because I find that some of the organizations I work with in rural communities actually tend to know their school superintendent and their county commissioner way better because they live on the same street or they grew up together. So that can be a huge thing. I see Lori's mentioned on that. Yeah, Lori, I had you in mind when I was thinking about that one in particular. So that's great. All right, so these are some of the challenges that you're all experiencing, right? And I think that they illustrate a good array of the difficulties and challenges that people are experiencing and organizations like yours are with respect to gathering that evidence you need and then turning that into a credible case for funding. So I'll share a couple of others here, and you might resonate with some of these. One of the challenges that I think organizations have is really around obtaining a sense of clarity about what they do. So for some organizations, they might be thinking, hey, we have these goals, but they're kind of broad. It's hard to translate them into something we can measure. Sometimes it feels like we're collecting data because we're supposed to, or because a funder tells us to, but not necessarily sure about how we'll actually do that, right? That can be kind of a challenging piece. And so having clarity around what those are, and everybody has goals, I'm sure as a part of your grant requirements, you've had to fill them out dozens of times. And so I don't want to suggest to you that you don't have them, but it's more along the lines of, are those goals meaningful? Do they drive your work? Do all your staff know about them? And are all the things that you're working on aligned towards those goals? And that's that piece of clarity that can be sometimes challenging for organizations. A second one is around impact, right? So you might be able to say, I can tell you how many people we served, how many people were in our programs, how many people saw our ads and our social media campaigns. I can tell you how many people showed up at our alternative activities that we had put together on Friday nights during the fall. I can tell you how many people showed up at our festival or how many people we engaged with when we went to a local health fair. Or maybe you have information on how many people you were able to provide resources to, like lockboxes or naloxone, right? The challenge is then what happens with that? What happens with that lockbox once it's been distributed? Are people be able to lock up their meds or their alcohol? What happens when the naloxone is distributed? Do we have information on how that may have been used in a way to help with a reversal of an overdose? Do we have information on how many people saw those ads and might have had some types of opinions or perspectives changed as a result? That's going to be really challenging to do, is how do we push from that sense of outputs of what you're doing and counting of what you do every day and turning that into outcomes. It's so important to do that, but not always easy, especially in prevention, because so much of what you're doing is this community level, population level change. And it's usually you and maybe just you or a handful of staff at your organization trying to do it. So it's not super easy to do. Possible, but not easy. A third challenge you might be running into is says, you know, this could be an organization like someone on this call. Hey, we're doing some strong work, but I don't think we're telling the story in a way that resonates with funders. We're often reacting to what funders ask for instead of proactively showing our value. And I think that I know I could raise my hand on this call to this question that I'm about to give, but how many of you have looked at a grant proposal and said, I don't know if it's a perfect fit, but I got to apply, right? And you put that apply and you almost feel like you're kind of like forcing your organization and mission into some type of solution, right, to be able to fit this particular funder's priority or need. And what happens is that you can do that once and maybe you get away with it and you're able to get some new funding, or maybe you try it again and it kind of works. But when you have a history of doing that over 3, 4, 5, 10 years, you end up 10 years later and you have all these different programs and services, but it's not entirely clear what you are and what you do and what you're trying to advance in the community. And the community sees you in different ways depending on what that grant funder's priorities all were for each of those initiatives. And so having an ability to be able to be proactive and saying, this is who we are, this is what we do, and this is the specific impact that we have in the community. And going into conversations with grant officers and funders and stakeholders with that confidence that says, hey, we know exactly what we do, and we know exactly this impact that we're making, and we know exactly why it's important to this community, with that sense of confidence that attracts people, rather than being in that situation of feeling like you're kind of desperately filling out grant applications at the last minute, at the 11th hour, to try and make funding and payroll for the next fiscal year, right? So now, many of you had an opportunity to take the scorecard. And again, I'm so sorry about the states issue. I'm going to have to figure out how to update that and get all 50 states. And if some of you are coming from US territories as well, I'll get you all included. But what I'd like you to do as a quick poll here is, based on your scorecard findings, which of the following is your biggest challenge? Now, after you've taken the scorecard, it should show up in an email. So if you dig into your email, you should see some results there. And it'll show you a place where you can access kind of your score on each of these indicators relating to clarity, impact, and funding. So, but to get us, have all the information here for us so we can have a little conversation around some of those big challenges, take a minute. You can use a phone, grab your cell phone, right? And just kind of do a little QR code and be able to QR code your way on here to be able to respond. And it's super easy, this little tool. Once you click on the code, it just kind of opens right on up. Let's see if I can get mine to work. There we go. There you go. And you can join anonymously if you want to, or put your name, that's fine. And then once you click on join, you should be able to just go ahead and click. And you can drop in, what is your biggest challenge? Clarity, impact, funding. Of course, if you're in that situation where you feel like, oh my gosh, it's everything, you're also welcome to say, help, it's all three at the bottom, if you'd like to. So go ahead and drop in your responses. And this is always so fun. It's like the horse race, right? As things go up and down. Like, is it going to be clarity? Is it going to be impact? Is it going to be funding? We'll see how it goes. We got impact is currently in the lead, but not by much. We'll see how it goes as people continue to respond. Looks like we have 24 responses so far. Let's see a few more as they come on in. So again, if you were away for a second, you just came back, we're taking a quick poll based on your scorecard findings. Which of the following area is your biggest challenge? And it's the area of clarity, which is kind of around goal setting, knowing who you are and what you do. The second around impact, which is gathering the evidence needed and the data needed to demonstrate that what you're doing is having an important impact in the community. And the last one being that funding piece, which is being able to translate all that information into a funding and a compelling funding narrative, right? All right. So it looks like here we've got about 39, 40 responses, and it looks like for more or less, it's been interesting. It's gone up and down, but it's been pretty consistent throughout that we have 48% saying impact, around 30% saying funding, 28 clarity, and 2% saying help. It's all three. So good for that person out there. Hey, don't worry. The best thing is that this whole presentation is going to be for you. So I hope it'll be useful for you. Now, I do want to focus on this one on impact because the impact piece is one of the most important core pieces to this. And I think sometimes what happens is that we see impact as separate from these other things, right? So when I talk to some of the clients that I've worked with or other organizations, the thing is like, hey, we need data, or we've got this requirement that we've got to meet. How can we go gather the data or the information we need? And we kind of silo that. We put it into this one kind of space in our brain that says, okay, we're going to focus on just this impact piece to gather the information we need for this one need. The challenge is that we don't often see how interrelated these three things are. And so for those of you who are building up that capacity on impact or desire to do that, I encourage you as a part of this presentation and moving forward is to think about how you can use that data in more expansive ways across your organization to help your organization make better decisions, to assess community needs, to evaluate the effectiveness of programs and services you're offering, but then to take all of that information and give it to somebody else beyond your current funder, right? Beyond that federal grant requirement reportment that you're sending back, your DFC core measures, your GPRA data, whatever those things are to those federal funders, or if you have something equivalent at the state level, how can you take that information and share that with somebody else, a community foundation, share it with a national foundation, share it with a community of supporters in your organization, share it with your volunteers, share it with your own staff so that they have the information that they need to be more effective practitioners, right? And we'll talk a little bit about how to do that today, but that's one thing that I'll encourage you all to do today. So very useful here. Impact being, it looks like after 46 responses, the biggest one. All right. Now, what we're going to do for a minute here is take about 8 minutes where you are going to go off into breakout discussion groups. And you'll have an opportunity to introduce yourselves and then talk a little bit about your scorecard. So what is it that surprised you? What were some of your biggest strengths? Sometimes we gloss over the strengths and go straight to the hard stuff, but I do want you to validate those strengths and those things that you feel like you're doing really well already in your organization. And then also identify some areas for growth. So we're going to take about 8 to 10 minutes or so to do that. And Amber is going to set us up to put us into breakout discussions, and then we'll come on back. So as you go into your breakout groups, all you need is the scorecard information, which you should have a link in your email to be able to find that out. And you'll be able to kind of talk about it there, and we'll come back and discuss that together as a group. As you go out into your breakout discussions, all you have to do is kind of talk about the scorecard. I know some of you may be in a situation where you can't join a breakout session, so we're going to make them big enough so that if you can't join, you can just stay off camera and continue driving if you need to keep driving and just listen in or whatever it is you need to do. But we'll be back in 8 minutes. Amber, can you send us over?
I can. I have everything set up, and I just wanted to reiterate what Drew said, that if you're not in a position to be able to come off camera and engage in the conversation, that's okay. But if you are in a position to, please do so. And if you have any issues, we'll be in the main room to help find a room or get you anything that you may need. So I'm going to go ahead and start the breakout sessions now. It should pop up on your screen and you'll just click and join your session, and they are live. It looks like people are joining. And if there's anybody in this main room that is in a position to be able to join a breakout session and you haven't made your way there, please let me know and I can put you in a session. I see that a lot of people have their camera off and that's okay. But if you are in a position, let me know. And I'll just assume that everybody that's staying in this room is not able to participate in the breakout. Drew, I'm going to go ahead and, okay, how long did you say?
Let's say 8 minutes. So maybe 12:30, 8:39, somewhere in there.
12:39. Okay. I am going to go ahead and see. Let me just broadcast that. Can you share your screen again so I can broadcast that?
Oh, yeah.
Jenna, it looks like you have your hand raised. Are you trying to make it to a breakout session? You're on mute. Let me take you off mute. Okay, I just sent the request, so.
Okay, that's fine. I don't have any questions or anything. So do I just look at what's in the breakout discussion?
Yes. I'm gonna put. Did you get the prompt to join a breakout?
No, I didn't.
Okay, let me go ahead and trying to multitask. Give me 1 second so I can broadcast this. Angelica, if you are in a position to look at the breakout rooms to see if you can figure out how to put her in a breakout room.
I think I hit the wrong thing. I didn't go to a breakout room either.
Okay, give me 1 second. I'm almost done. What are your?
Yeah, I'm trying to get them into it, but it's not giving me the option. I think it might be because
give me
you're
1 second.
host.
Of growth. And if we can't get you in a room, we can always do it here. Okay. Let's see. Okay, I see. In lobby. All right, Drew, can you stop sharing again? Sorry.
Sure, no problem.
Just so I can see everybody
Yeah.
and their names. Okay, so it was. It's really odd. You know, you think you have things figured out, and then they make an update and they make it difficult to.
Yeah, I just don't see where it's giving the option. I don't know if
Yeah,
you're.
you have to actually go to the breakout. There's on the bottom screen it says breakout sessions, and typically what it would show in the past would be in the lobby or in the main session, but I'm not seeing that. And this is okay. How about we do this? How about we go ahead and just have the conversation here? Because I don't want to waste any more of people's time. And the prompt, okay, Drew, one more time, if you could share that again.
Absolutely. 1 second. I'll just
Okay,
pull it up here in a second.
We're going to talk about the scorecard.
Yeah.
And Drew has some prompts, so feel free to come off. I'm going to put everybody that has their screen on. I'm giving you the ability to come off mute. If you'd like to participate in the conversation, please do so. So the first question is, we're going to move past introducing ourselves, is going back to your scorecard, the first question, what surprised you? So if anybody's willing to share anything that was particularly surprising.
Amber, that's what I was saying earlier. I never got, did I miss the scorecard? Because I never seen a
Oh, I
scorecard.
apologize. Yeah, that's okay. Things were moving really quickly. We put it in a chat a few times. I am going to put the scorecard back in the chat for you.
Yep. I just dropped it in there too.
Okay, you did. Okay.
So yeah, what will happen is that link in there says commongooddata.com/prevention. And as you click on that link, the first button you'll see on there should be one that says take the scorecard. And so go ahead and click on take the scorecard, and maybe during our breakout session, you can take it so that way you can follow along for the rest of the presentation moving forward. But thank you so much for sharing that. But other thoughts or comments that people had as they were going through the scorecard?
Now the scorecard is the one that told you your percentage, right? Because mine was like 67%.
That's right.
That's what we're talking about.
Yep.
Okay, I was surprised mine was even that high. I was like, wow, I'm doing better than I thought. Because I was looking for it to be much lower.
Much lower. Well, Denise, thank you for sharing that. I think that's a great thing that actually comes up sometimes is we oftentimes don't give ourselves enough credit for the things that we are doing, and it may be that some of the core pieces that you have in place there. I mean, many of the things that you'll see in the scorecard are kind of part of a traditional grant cycle that you'd see from a federal grant or a state grant that'll ask things about setting goals and metrics and logic models and putting those things together, as well as the data and develop plan. So you'll probably see that some of these things you have in place. So great comment. How about somebody else can share something else that surprised them as they took the scorecard? Yeah, go for it, Evelia. I don't know if I said your name correctly.
Honestly, it didn't surprise anything because we had all the issues. It's about impact funding, and I wasn't surprised. I said, yes, we have the same issue, trying to do our best, but money, community participation is really tough, especially during this time.
Yeah. Yeah, and I think part of the challenge that comes into that's really a part of all these pieces is that you can have a great sense of who you are and what you do, and also have methods for going out and collecting that information and gathering that data and impact. But that community piece is so important. And how do we kind of continue to find ways to engage others and increase the uptake of people who want to participate in programs and services, or help us to engage in coalition work and things like that. And I know for right now, this can be difficult for many communities who, between pandemic and changes at the federal level and whatnot, to be able to kind of come out and join for these types of activities. Other thoughts? And we can share maybe their biggest strength or maybe an area for growth in our last couple minutes we have.
Well, I've been working in prevention for 25 years for Baycare Behavioral Health in Florida. And I've been in outreach and prevention where we go in the community and we go into the schools and facilitate substance abuse curriculum. So when I just did the scorecard, and maybe I just was skimming through the questions very quickly, but it said 100%. But what I can say, we're not for profit, but we do a lot of work in the community with helping youth and adults in reference to prevention, providing substance abuse prevention life skills trainings in the community. So clarity, yes, but sometimes it depends on the grants and the funding that comes in, that we have to make sure that we're dotting all our I's and crossing all of our T's and making sure we're meeting the needs of the community.
Yeah, absolutely. General, thank you for sharing. And I think, you mentioned life skills training is a big piece of that. And for many of you who are doing evidence-based curricula like life skills training or Too Good for Drugs or others, you probably have some procedures in place to think a little bit about how do you, measure changes over time. Maybe you've got a pre-post survey or something to that effect. And what I'm hoping is, and we'll kind of extend that conversation on today, as everyone comes back from our groups, and Amber, you can call people back, I think, at this point.
They're already coming back, Drew.
Okay, good.
They officially close in 24 seconds. So
okay, gotcha. But to finish the thought, Jenna, is to kind of take that next step then, right? So now that you know that maybe you're working on kind of continuing to deliver this curriculum, whether it's in schools or outside of schools, to adults and youth, how do you take the results of that and then turn that into an important funding narrative that you can share, not just with state and federal grant opportunities, but also others as well to continue to support your work? And we'll talk about that in our session together. Yeah. I'm not saying you don't, but just kind of something to think about.
Yeah, we have pre-post tests, so and then we got a lot of stuff. Okay.
Awesome. Well, welcome everyone. I know I see just about everybody's coming back from their groups and whatnot, which is fantastic. And hopefully you guys had some great conversations as well in the small groups. And so what I'd love to do is you can either come off mute to share aloud or drop your response in the chat. What were some of the common strengths and challenges in some of your small groups? And I'd love to hear from folks. If anybody's willing to come off mute, maybe we'll take 2 or 3 off mute, and then we'll also read some from the chat. So can someone come off mute to share a little bit about what they talked about in their small groups?
In our group, we had someone from New Hampshire, Indiana, and Texas. And some of the same challenges we were seeing was people understanding that these are universal programs that we're talking about. The mental health stigma, that they don't think, trying to get consent from parents and families. And also like the challenges of not fully understanding that these prevention programs, although we're focusing possibly, they see the mental health, that it is a prevention groundwork to try to help youth stay off of or doing substance misuse or turning to drugs, alcohol, and other substances to self-medicate.
Yeah, I think sometimes there's a lot, some of those challenges around trying to have part of that piece of clarity that we're going to talk about is not only knowing who you are and what you do, but making sure that the community understands it as well. And sometimes it can be really difficult for folks who maybe are less familiar with prevention work to really understand what it is that you're trying to do. They might think of maybe experiences that they've had in drug or alcohol education or programs that they've had in the past, and recognize that maybe something you're doing is a little different too, as prevention has evolved over time. And that clarity piece is being really solid and knowing what you do, but also making sure that your community does. So great point there. Let's take another one off mute. Someone can share some common strengths or challenges, that came up in the small groups.
Sustainability in our group, and some people, just opened a new nonprofit, and so they're here to listen and learn. And we're just kind of getting to know each other. We actually had 2 people from Ohio in our group, and so we were kind of connecting and chit-chatting.
Oh, awesome. Well, congrats on the person who's starting their new nonprofit. I'll give you an applause. That's not an easy job. And also a big shout out to the heart of it all. I'm also an Ohioan by birth, so it's great to see folks from Ohio on the call. Grew up in Cincinnati, so. Let's take one more, maybe somebody come off the chat to kind of share some of their kind of things they talked about in their small group.
Well, our group talked a lot about rurality and, being in a remote area and competing with, each other for grant monies. And I think that, and just being really remote, I think that was a really common theme in what we were talking about.
Yeah, I think that's such a great point. And the challenge being that you're feeling like sometimes you're competing with the rural community next to you. Sometimes you're competing with maybe a more urban or more well-resourced area in some cases, or at least that just has more higher population level that might kind of draw the other attention, right? And so you can sometimes feel like, how do you kind of gain that sense of attention and knowledge about the work that your organization is doing and how it's so important in a rural area? So thank you for mentioning that. I'm going to hop over to the chat here to a couple other things that people might have been mentioning, right? So we've got limited staff in rural areas or large coverage areas. We also, Amy mentions state legislation or bills that create barriers for data collection. I think that's a big one. I know that some states have passed laws like Parents' Bill of Rights or others that are designed to ensure that parents have the ability to be able to really know what's going on with their child's education and what's going on in schools. But as a result of that, it also requires a lot of active opt-in for some things that might have traditionally been a standard part of curriculum and operations in a school setting. And so it make it more difficult sometimes to collect survey data and information at a population level for schools. So I thank you, Amy, for mentioning that. I appreciate that. Colin mentions the difficulty of spreading the word about programs and initiatives. Very good. And then Salvador and Jennifer mentioned the same thing for the opt-in and opt-out challenges that folks have had before too, right? Julie mentions, I think, really interesting. They said, wish you could have 10 more minutes to chat. I know, I wish too. We only have an hour and a half together. So, but you mentioned the conversation about the benefits versus the challenges in high overhead on funding applications. Yeah. And this is one of those things where it's really important to know your funder. Sometimes you'll see with state and federal grant applications, sometimes there'll be a cap or a limit on quote unquote overhead expenses and things like that. And that can be challenging. At the same time, federal and state are sometimes some of the best sources for recognizing the importance and need for capacity building and ensuring that you have the staff who are able to deliver on the programs and services. And I think that, again, it comes down into that changing that conversation around who you do and what you do into outcomes and impact, or in outcomes for funding, right? So for example, if you say, hey, I need you to staff 2 positions, there's gonna be all kinds of questions around, well, okay, how do I staff? What percentage of that is going to staff versus directly to people? And you get kind of caught in this conversation that's kind of a losing game for prevention providers. But instead of saying, I need funding for 2 positions, you turn it around and say, we right now are delivering programs and services to 200 people. And in those 200 people, we know that youth consistently come out of those programs knowing that the risks of vaping, who are able to also communicate and change social norms around vaping practices, and are also less likely to get suspended or use vapes and get themselves in trouble at school. And if you focus it on outcomes, on what you accomplish, funders start to care a little bit less about how you do it, right? And that conversation around overhead becomes less and less important. So this is one of those key things in shifting that conversation in your funding appeals away from what you do and the staff required to accomplish it, and towards the impact and the outcomes that you have in the community, and why it's so important to stay there. Because ultimately, that's what funders want, right? They want to see that impact in the community. They actually don't care about overhead, in my opinion. Most don't. I mean, sometimes they'll have rules or regulations, and there's nuance to that question. But the average funder out there is much more interested in what you're doing and the impact that you're having. And if you can communicate it and stay there, that helps you to overcome some of these overhead questions. So Julie, I'm so glad you mentioned that question. It's a really good one as well. And we had a couple more in here too around Spanish speaking questions too. And I think we'll try to get to some conversations around those as well. But I want to keep us moving so that we can make our way through our presentation. So as I've talked a lot about these 3 words, clarity, impact, and funding, we're going to walk a little bit through what this model looks like and how it might be helpful to you as you're thinking about ways to position your organization for some of those funding conversations. So here's kind of a model that I've developed and I share with many of the organizations that I've worked with, called the Clarity Impact Funding Framework. And I'm going to walk through these 3 pieces and what takes place to help you do it. Now, for those of you who are in prevention, you'll see that this program kind of maps a little bit along to the strategic prevention framework. You'll see a lot of similarities between those 2 things. But what I'm trying to do is extend the idea of the strategic prevention framework to really help people think a little bit about positioning their organization for funding. And so I think that's how it'll most resonate with a prevention audience on this call. So let's begin with clarity, right? Clarity begins in this sort of circular wheel of clarity, impact, and funding. Always begins with that sense of beginning with assessing community needs. And we talked about this a little bit on the call already, but how do you engage folks? What are particular challenges that are unique to specific communities? We had one in the chat around Spanish-speaking communities, for example. Really understanding who your community is. Now, I always encourage folks to take an expansive view of this. We sometimes think, okay, let's survey the community. It's not a bad idea, but I think that there's also other ways you can do that through even informal methods, things like town halls, one-on-one conversations. And I've worked with some organizations who have launched these amazing one-on-one campaigns that get everybody in their community talking about what they're interested in, which is alcohol and drug prevention, and then share that information back in a less formal setting for community needs. But in any case, once you have that sense of what your community needs, you then develop a plan to address it, right? And that can be done through theories of change or logic models you've probably seen before. You might be seeing impact plans. You're going to be launching or thinking about evidence-based programs or approaches or strategies that you could use. You might be thinking of some of the 7 CADCA strategies to address change for those who do coalition work. And ultimately, by the end of this planning process of getting all people together to understand the challenges in the community, you're going to identify some type of outputs and outcomes that you're going to accomplish. How many people you're going to serve and what change you are going to see in the community as a result of it. And that's this key piece in this clarity, is having really solid sense of what it is you want to change. Now, of course, all of you who do prevention work want to reduce youth substance use in some degree, right? That's the reason why you're probably on this call, is because you do something related to that. And maybe you have some other outcomes as well related to mental health or SEL or academic well-being for youth and things like that. But ultimately, substance use is a big one. But what I will say is that that outcome, especially at a population level, can be difficult for one organization to change. And so as you think about your outcomes, try to think about things that you can have an immediate impact on. And sometimes that's things like changing perceptions, changing social norms, changing access in a community, changing a perception of risk, or maybe parents' approval or disapproval of a particular drug or substance. And some of those, what we call intervening variables, are good places to really identify outcomes you're most interested in. I think that some organizations who say, look, we're going to go all in on parents, and we're really going to focus on communicating with parents the importance of having conversations with their children about substance use, making sure that we're talking to parents about limiting access in their home to substances for their child, and also empowering parents to become advocates in the community about it. Well, then all of a sudden we have new outcomes, right? It's not necessarily a 30-day use outcome for youth. Now we have all these parenting outcomes that we really need to focus on and communicate as an important part of our organization's identity and brand. So that's an important thing to be thinking about with Clarity. In the second section here, we start to talk about impact. And this is where you take these ideas and planning and you put it into action. You're delivering programs and services. You're launching media campaigns. You have awareness activities. You're hosting events. You're putting together alternative activities for youth to participate in, right? And in that whole process, you're probably doing some type of data collection. You've got maybe a design for an evaluation, some data collection protocols. You probably have some surveys. Maybe you have some pre-post surveys you can implement for some of these programs. And you're starting to find ways to develop data analysis and reporting that can communicate all of that information. This is a big one, and it's not always easy to do in prevention. And the key here is this question is to go all the way around this circle, right? Not just to have a survey, but to collect the data. Not just to have the data, but to report it back to funders. And not just to have it report back to funders, but to also share that information more broadly with the community. People beyond your immediate funders, because other people will need to know. And you can do that through dashboards and reporting and all kinds of creative strategies. Now, lastly, we have this section around funding. And this is a section that I think gets oftentimes kind of thought about as separate from the work around data and impact, right? We think, oh, okay, I've got one person who goes out and delivers Botfin life skills training with our school community, and they deliver that amazing program all the time, and they're so great, and they're connected to parents and kids in schools. Amazing, right? And then you have another person who's your grant writer or your development person. And those two individuals are different in your organization. They don't necessarily see each other all the time every day. Maybe they are a little bit siloed in your organization. Or maybe you're just one person and you have to do all these things. And maybe this is the one that maybe gets the least attention because you're always trying to respond to the challenges and the parents and the youth who are right in front of your desk every day. The point here is that after you've developed and implemented these programs and had this great success in the community and you've been able to demonstrate that, it's so critical to always be thinking about how you can communicate that success out to the community. And you can do that through incredible storytelling work. I have talked to organizations who do fantastic, amazing things on YouTube and Instagram Reels, for example, that share testimonials of individuals who have gone through their programs and found them to be life-changing. I've worked with organizations who have put together arts programming that focuses on substance use challenges, and they have an entire theater production that focuses on a particular topic, and then they record that and share that with the community and invite people to come who never would have otherwise engaged with prevention type of work before. We talk about advocacy as an important way to do this. How many times have you had an opportunity to communicate with a county commissioner, with your town council or your mayor, another elected official, or somebody else maybe in state and local government to communicate just who you are and what you do? You elected them, right? They're there to serve you, and that includes you and your organization. And so what can you do to say, hey, when we had this great success with this program, I'm going to go tell my city council person about this just so that they know, like, the impact that we're having in this community. And you never know how that conversation may lead to open other doors for your organization in the future. Thought leadership, the importance of your organization, especially somebody who's in a leadership role in your organization, like a program director or executive director, to always be talking and getting in front of community, talking about it on social media, going to, like a local Rotary to be able to talk about the work that you're doing, to go to a Chamber of Commerce and other local groups that are meeting and talking about the important issues going on in the community for businesses and organizations and nonprofits, and getting that information out there so that when somebody says, oh, we have a real particular challenge in this community around substance use, they see your organization as the #1 organization to go to be able to help solve that problem. And then, of course, we've got our grant writing and donor stewardship and relationship building. And I see these as part of, but never the only source of engaging in activity that's supposed to generate funding for your organization. I think sometimes there's a temptation in the prevention world, and I think over the past 10 years, we've learned a little bit about this, that we could have success if we just had a really strong grant writer. If you have a strong grant writer who can get that information to state and federal funds, the funds would come in, support the work, and you move on. That's not going to be enough in our new environments, right? We have to be thinking more holistically about approaching funding through a wide variety of streams, some of which are direct asks, like a donor stewardship activity or a grant writing activity where you're making a specific ask for a specific amount of funding. But you also have to engage in activities that aren't necessarily direct asks, but are positioning your organization as the leader on substance use prevention in your community, and to make sure that everybody knows exactly who you are and what you do and the impact that you have been having. And that's what's so critical with this funding piece, right? All right, so let's go to our next section here. So this is kind of this whole framework together. One thing that at the center of it, we have this notion of trust and culture and capacity, like all these things that are so critical and important. Without them, you cannot do any of this work, right? The importance of recognizing that you have to have trust to be able to actually have folks come to your programs and services and deliver it out. And well, I'll pause on that for now because I want to keep moving with our presentation, but I want to emphasize that those are still really critical and important. So what happens, though, I think with organizations is they run into kind of a bridge problem. And I'll describe what I mean by a bridge problem here in a second. But for those of you who do not know, this is a bridge in southern France. It's the Bridge of Avignon. So for those of you who maybe remember the child tune, On the Bridge of Avignon, they're all dancing. This is that bridge. And I had the lovely opportunity to go visit the Bridge of Avignon. And I was excited because I was like, oh, good. I can't wait to go see this bridge. It's going to be so good. It's been on childhood song. Let's find out what it's about. And a trip that I had to France this past summer, which was amazing. But I was surprised when I got there and I found that the bridge only goes halfway into the river and then stops. And I was like, wait, what? This is the bridge? Like you're supposed to be, I just had this image of people crossing the river and like dancing or whatever, like in the song, right? But it goes all the way out halfway and then simply stops. And I found that this is really a good metaphor for, I think, what a lot of people in the nonprofit sector and in prevention particularly right now are experiencing with their programs and services, is that we're always getting like almost there, but not quite all the way there. The kind of all the way there that would bring about a sense of comfort and stability and sustainability in the organizations that we operate in, right? And if you think, this is actually an image right here of the Bridge of Avignon. This is like a drawing from 1575, I think I found on the internet, which is pretty fun. That the bridge, of course, used to cross the entire River Rhone in southern France. But of course, the challenge is that the River Rhone is an unruly river, right? And that river will come down with water and it will flood and it will bring things and it will shift the direction in places. And that ultimately led to having sections of the bridge collapse, get rebuilt, collapse, and get rebuilt. And I thought to myself, isn't that kind of a good metaphor for the work that we do sometimes when you feel like you finally got things going again and all of a sudden the river that we're all swimming in changes in some particular important way, and something that used to be working isn't working anymore and it collapses, right? That's kind of the challenge that we've had with this bridge. And what I'd like to propose to you as you think about that clarity, impact, and funding framework that I shared with you previously is the idea that each of these are important pillars of that bridge that you're trying to build that is going to represent kind of the sustainability and function and ability of your organization capacity to do great work. And what you're trying to do really is build this relationship of trust between your organizations and funders and stakeholders. Right? That's what doing this clarity, impact, and funding work is about. It's about building a sense of trust between your organization and funders and stakeholders. You build trust when you have clarity over what you do. When people within your organization and outside your organization know exactly who you are and exactly what you do. Because you can't trust somebody if you don't fully understand who they are or what they do, right? You build trust with an organization when you're able to develop processes for demonstrating and communicating impact in clear ways. You have very clear outcomes that are very easy to understand and not academic and not jargony, but very clear to understand in spoken language so that when people hear about your organization, they say, yeah, I know exactly what you do. And I heard that you did X, Y, or Z thing in the community last year. And then lastly, you build trust when you're able to generate the kind of sustainable organization where people can look at your organization and say, I know that that organization is a solid, well-run organization, and it's going to be here 5 and 10 years and 15 years from now because of the amazing work that you're doing. Now, I was on a presentation the other day, and I kind of had a bit of an insight I wanted to share with you all that I think is an important way of thinking about the relationship between trust and Clarity Impact and Funding, which is you might have many requests for somebody to ask for data or evidence from your organization, right? Can someone send me a report? Submit your data and outcomes up to our online portal, put together an Excel sheet, right? And we get kind of fixated on those technical things like, oh my gosh, I really got to figure out how I'm going to get my 30-day use data uploaded or whatever, my 4 core measures. I really got to figure out how to share this information to meet this grant requirement. But I want to invite you to reframe that question next time you hear it. When someone says, can you share some data or evidence with me? What I want you to instead hear is what the funder is trying to say is, can I trust you? Right? What they're trying to say is, can I trust you? And that's all you're trying to do, is to build in these processes and pieces in place in your organization to communicate a sense of transparency and trust so that that organization can say, absolutely, we would love to support your organization. And when we make that shift from going from a sense of feeling like, oh my gosh, you know, what is, how do I get all this data and impact together? How do I wrangle all these spreadsheets and figure out all these surveys and manage all of my interviews and focus groups or whatever it is you're doing to gather evidence? If you turn that conversation around to say, how can these tools be one way that our organization can communicate a sense of trust and transparency with our funders and the broader community, it really shifts how you think about it. It's no longer this sort of requirement or this difficulty. It's more of this creative opportunity for you to strengthen a relationship, which ultimately is at the root of everything we do, that is rooted in trust. So today, towards the end of our time together, what I'd like to do is to build a bridge. And you will see on that same link, I think we can drop it in the chat here as well, just so that you have access to it. I'll drop it one more time. But if you click on that link, there'll be a download there for a handout, and it says, the framework, build a bridge worksheet. And so what we're going to do is get a chance to build a bridge. It talks a little bit about Clarity, Impact, and Funding at a very high level, but just to go through a quick exercise to help you think about it differently, right? So you can hop to that website, download that worksheet, which is there available just on a quick download. So go ahead and click there and download. And I'll walk through an example of what this might look like using this worksheet. So what I'd like to do first is to use an example that might be common or familiar to you, which is the Talk They Hear You campaign. And for those of you who don't know, this is a campaign from SAMHSA that encourages parents to have conversations with their children about alcohol, and to use that in a language of prevention to help youth understand the challenges and the risks of using alcohol, and hopefully to lead to delaying onset of use, right? Now, if you speak about Talk They Hear You, here's an example of having strong sense of clarity over what that program particularly aims to accomplish. So for example, you could say, we help parents talk with their children early about alcohol to reduce underage drinking risk. It's very clear. You know who we're talking to, we know what they're talking about, and we know what the outcome is, which is to reduce underage drinking, right? We can translate that into impact by saying we measure these increases in parent communication and shifts in youth attitudes and behaviors. So this is very specific, right? It says we're going to change parent communication styles, and we're also going to shift attitudes and behaviors. Now, I only have one slide, so I didn't go into detail as exactly how that would be measured, but you know, a next level conversation would be, how do you measure parent communication and youth attitudes and behaviors? But you can imagine it might be observing changes where parents might have been afraid to talk to their child about alcohol. They might not know the words to say to talk about alcohol. They might not know how to bring it up in conversation in a way that seems natural and loving, as opposed to coming down and saying, all right, children, you know, all right, you know, the name of the child, we're going to talk about alcohol in a way that's kind of scary, right? So parents, you know, have this sort of reticence to have this conversation with their child. And the Talk They Hear You campaign kind of helps people think through that. with the goal of changing those attitudes and behaviors. So again, you have clarity around what it is, you've got impact that we're showing here, and then how do we then change that into a narrative that's meaningful for people who are trying to, also continue to find the resources you need to continue this work? Well, you might be able to make the argument that says, hey, this work, this Talk They Hear You campaign is going to reduce early initiation and long-term substance use and lower healthcare and social costs. And a key thing here where it says lowering healthcare and social costs talks a little bit about how you connect impact to a specific type of cost and including those costs in the conversation that you're having around impact. Now, sometimes you'll hear the term cost effective analysis or cost inclusive analysis. And sometimes we haven't really done this. It's been difficult. Sometimes we struggle so hard to measure the behavioral changes that we're like, oh my gosh, now I add a dollar value to that. That makes it really challenging. But this can be one way that you can sort of make that appeal to funders that says, hey, investing in prevention is worthwhile. Now, many of you who are on this call know that there's a whole ton of research that says that, a dollar invested in prevention saves, $5, $8, $10, depending on the study, whatever it is, in treatment and recovery in the long run, right? Or in other types of social costs that can come as a result of the consequences of youth substance use. And we know that information broadly. But what can be so compelling to funders is when you take that outcome information from the impact section here and make it meaningful in the work that you're specifically doing. So that when you go to a community foundation and you're giving that talk at a Rotary Club and you're having a conversation with a city council member or a county commissioner, you can say investments in our program are going to yield long-term financial results that are helpful for our community who has limited resources to spend on youth well-being. And making that case as a part of your work can be so, so critical. Now, second, let's go back. Let's bring it all together. Here on the bottom is a way you can put it all together in a nice little elevator pitch. We aim to increase parent-child conversations about alcohol among youth ages 9 to 15 to reduce early underage drinking. And we know this is happening through increased parent confidence and communication, along with positive shifts in attitude and delayed initiation. This matters because early prevention reduces long-term substance risk and lowers healthcare and social costs. Now, you can still say a lot of these things because the research is there for it in most cases, so you can do your research searches and cite it, but it becomes even stronger if you can show it with your own data. Now, for those of you who don't necessarily focus on alcohol, I want to make sure I give another example. So here's one on school vaping. I'm getting ahead of myself here. My mouse always clicks ahead. Okay, let's start with clarity. Clarity. Let's say you're focusing on a school vaping initiative and you recognize that maybe you did a needs assessment and you recognize that there's a particular challenge around vaping in your community. And so what you want to say is we aim to reduce youth vaping among middle and high school students to prevent disciplinary actions and support healthier school environments. Now, I'm not sure about all of you, but the conversations I've had with people all over the country is that this link between school vaping vaping and school discipline are really, really tight. Because what's different about vaping as opposed to alcohol or other substances is that they show up in schools more frequently, just because of the nature of what it is. And what's happening is that a lot of students are getting suspended, right? They're running into situations where they're getting brought into a school discipline situation when they normally wouldn't have. They were a child or a student who otherwise would not have been involved in student discipline, and now they are as a result of this substance use challenge. And that has other types of consequences. And then we look at impact, right? So we can measure this through reductions in self-reported vaping. So we can look at that. We could also look at attitudes around vaping as well. But one thing that you can definitely measure, because it's a mandated school thing to measure across the country, and so you can look it up on your school district's website if you need to, is suspension data. And you can find that we're going to measure this by lowering the number of vaping-related suspensions, in the middle and high schools in our county, in our school district, in our community. And there you're making that clear connection between the prevention activity that you're doing and a clear outcome. Not just we served, 100 or 1,000 students in our district, not just that they went through our program, our vaping program, or our avoid program, or something like that. But you're able to actually look at the suspension data and say, we saw a huge reduction in suspensions, and we believe that part of our prevention work has been a part of bringing about that decrease over time. But then I encourage you to not stay there, to take it to the next step and make that connection to funding. So we can say here that avoiding even a small number of suspensions can save schools thousands of dollars in staff time and lost instructional resources, and reduce the long-term economic consequences associated with dropout. Now, there's a whole host of literature out there that you can find on existing research that says, what are the costs every time a child gets suspended or spends time out of school? And we know that can be linked to economic costs, That can be linked to social costs. That can be linked to academic costs, likelihood of dropout, etc. And when you connect these things that you're doing in the impact in the short term, reducing suspensions, to these longer term funding cases, you're able to make a compelling case to somebody who might not necessarily be in the prevention world, right? We know that SAMHSA understands your work. We know that your state, prevention people understand your work. But if you want to make a case to a local community foundation or to a national foundation or to a set of donors as you're building out a new donor database, right? It's this question, it's this piece here that really helps connect to people what this thing is, which I don't really fully understand, this vaping program that you're doing in a school, all the way to, oh yeah, I understand how important it is that students spend time in school as much as they can. And I can understand that there are going to be economic consequences when youth aren't in school and instead are being suspended. So those are two examples that I've given to you to think about. Now, what I'd like you all to do, since you have your worksheet here, right? Your SIF framework, building the worksheet. You might be filling it out on your computer, or if you just have a notepad, you can do the same thing there. But I'd like you to try and fill it out. So download the worksheet. We've got the link in the chat if you have already. Then I'd like you to print it out, or you can fill it out on your computer and complete this worksheet using an example of a program or an initiative that you're currently working on. Now, I know you're not necessarily going to have all that evidence data in front of you or necessarily be able to make that economic point. But what I'd like you to do is to try to. Like, imagine you did have that evidence, and imagine you could make some sort of case for an economic or some type of funding case at the end. I'd like you to try and replicate that same exercise that I gave with the Talk Bay Hear You and the school vaping example with a program that you're currently running. Okay? So let's take 2 or 3 minutes and start to think through that a little bit on your own. And what I'll do, we'll take maybe 2 minutes, start with Clarity, we'll share some examples, and then we'll walk through impact and funding as well. So take about 60 seconds or so to try to figure out one on Clarity, and we'll share some examples, and then we'll continue on with impact and funding as well. All right. Now, if some of you got that first step down with Clarity, go ahead and drop it in the chat. I'd love to see some examples that I can kind of talk through as well and provide some feedback on, so I can give you some feedback on ways to improve it, or maybe also identify some strengths so you can help some of the other folks on the call who might be doing this for the first time and trying to figure it out. So if you've got that step 1 Clarity box filled out, go ahead and drop your example in the chat. All righty, we've got our first example here in the chat. Thank you so much, Connor, for dropping that in there. And as you're you can keep working on your worksheet or kind of listen to as I kind of share some feedback. Connor shares, we aim to partner with local pharmacies in Marion County to implement low or no cost tobacco use screening and prescription services. Very clear, right? So what we're doing is we're partnering with, so we got our local pharmacies in Marion County, and we're implementing these low or no cost tobacco use screening and prescription services, right? Now, I think one way to extend that, Connor, is to be able to then say, well, what is it that screening is going to be able to accomplish? But you'll probably get to that in the impact section, so I'll let you save for that as well. Let's hear maybe one or two more examples in the chat of what you kind of wrote for that clarity section. One or two more examples. I love the example here that Connor mentions around partnering with local pharmacies. And it gets to, I think, in prevention work, we're always trying to build partnerships across some of our institutional silos, right? And sometimes you're working with law enforcement, you're working with schools, you're working with a public health department, you're working with a local business, you're working with the faith community. And Connor, I think, gave a great example here of what that can look like working with local pharmacies, because that's where people are oftentimes, and they're oftentimes very capable of being able to do some of those low or no cost tobacco use screening and then prescription services there to deliver them right there. Do you have another example that we can drop into the chat? Well, as we wait for one more to come on in, I'll let you all continue to think about it. Some of you are all going to start moving on to that impact section, right? So that first one around clarity, what are you trying to change? We talked about specific behaviors you're trying to seek to change. What does measurable success look like? The key here is that piece measurable. You really want to make sure that you have a good sense of the change that you're trying to accomplish is something that you can measure. And it's true, we can measure behavioral change, not just those sort of harder outcomes, but also changes in attitudes and behaviors, which is much of what prevention is all about. In that second section, we're going to talk a little bit about impact. So how do you know that it changed? And we want to move beyond those outputs, those things that we do. We served 100 people, we reached 1,000 people in our messaging, to start going into what changes as a result. And so consider then, what evidence do you have that a change is in fact happening? And what are you currently measuring? And what should you be measuring, right? Now, of course, in the statement, you probably just talk about what you are, but it's a good opportunity for you to think about what would be another outcome indicator that maybe you're not currently measuring that would be really helpful there. Now, if I hop over to the chat, Stephanie has a great example here that's looking at clarity again. So bringing 3 peer recovery coaches to a county that does not currently have anyone available. We're hoping to work with the health department for this endeavor. Thank you, Stephanie, so much for sharing. So having that peer recovery is so important, especially for those of you organizations that move beyond treatment, that are in treatment recovery, kind of across that continuum of care, right? Recognizing that you can kind of serve people all across that spectrum. And in this case here, we have a challenge or a problem. And this, for those of you who were talking about working rural communities earlier, I'm sure that this resonates, that we have a county that doesn't currently have anybody who can provide this service. And so what we're hoping to do is to bring, recovery coaches to that community to be able to do that. And you've got that who you're working with the health department, which is awesome. And now, Stephanie, I'm going to encourage you to try and take that statement and extend it one step further. What is it that you want those peer recovery coaches to be able to do? And how is it that you want to measure the results of their work, right? So with the peer recovery coaches, is the outcome, having conversations with other people who have experiences of substance use? Do we want to see some type of behavioral change there? Is it about staying drug-free to some degree? Is it about changes in attitudes or behaviors, or something else? And being clear about that outcome there can really help communicate again to your funder about why it is that they want to support those recovery coaches. So I gave you the example before when we were talking about the bridge question, right? Which is, oh, hey, we want you to fund 2 staff members. Awesome, but what is it that those 2 staff members are going to do? And as we focus more towards the outcomes of what they accomplish, we get less into a question of, okay, what's it going to cost? When you leave with the 3 recovery coaches, you might think, oh, shoot, that's going to bring a cost to us. What is it they're going to accomplish that's going to bring some great social benefit or reduce costs? So that's the thing to think about. All right, so we're on our step 2 impact. So what I'd love is for some other folks to drop them in. And Connor and Stephanie, you're welcome to continue to drop them in so we can see the example all the way through. But if others who have not shared yet want to drop in what you included for impact, I'd love to see that in the chat so we can provide some feedback and answer some questions along the way. Again, in our impact section here, what you really want to be focusing on is what changed, right? What is it the behavior that changed? When we're looking in youth prevention, a lot of times it's about changes in use. So 30-day use is as a common indicator, or changes in attitudes and behaviors. You might be looking at things like perceptions that it's easy to access a particular substance in a community. Maybe there's a change in their perception of peers' acceptance of a particular drug or substance. This is particularly true around vaping and marijuana, as we've seen, those become much more acceptable among youth populations than they were previously. Maybe when we're looking at things like parent disapproval, or perhaps perception of risk that something may be harmful to them or others. Those are some common indicators, but of course there's other ones as well. I gave in the vaping one the example of school suspensions. Sometimes you can look at, for population level data, you can look at things like auto accidents, ER visits, and things like that, especially if you do work in the prescription drugs or opioids or things like that. That can be a really important outcome indicator. So let's see one or two examples from Impact dropped into the chat here so we can see some lovely examples and ideas shared among our broader prevention community to help other people out, right, who are working on this on their own as well. What are some examples that we can have of some of those impact statements? I'll give you all a couple seconds. What I might do actually is bring up the school vaping example just so you can have an example of what one might look like. Chelsea has a great example here and mentions an awesome survey, the Clyde survey. Excellent. So we know this is happening through Clyde survey data that shows trends in youth attitudes, perceptions of harm, and intent to use, as well as successful policy adoption and increase in community engagement. That's amazing. I love that, right? Because here you've got, this is happening because you've got this great Clyde survey data. Now, for those of you who don't know, the Clyde survey is kind of like, there's Pride, there's a couple of different examples out there, but they're kind of industry examples of how to administer a school-based survey. And Clyde is a great example of one. And it shows trends in youth attitudes. So it's going to measure things like attitudes, perception of harm, and intent to use. And so you're able to kind of capture all of those core indicators that you're looking for in youth behaviors. And so you can see that that's a good measure. I also love, Chelsea, that you included the successful policy adoption and increase in community engagement, right? So when we see policies adopted, that's an outcome of your work. And sometimes we don't always think about that per se because, it's a piece of paper somewhere or it's a law that's written or a new policy adopted. Maybe your school changes a policy or there's a local ordinance that changes. But mapping some of those policy adoptions can really show that your work goes beyond individuals. And it really is starting to work at a population level. You're bringing about change in an entire community because a whole policy that affects an entire county or jurisdiction is now in place. So I loved that example. Thank you so much, Chelsea, for sharing. All right. Well, that was a great example. So I want to continue on because I know we have just a few minutes left to our funding example. So with this last one, as you're working on it, try to think about ways of connecting those outcomes to value and always try to put yourself in the position of a funder. And you can imagine yourself as a grant officer at the federal level. Maybe there's some contact that you have at the state level or an MCO that you work with or something along those lines, right? And think and put yourself in that position and consider, why does this change matter to a particular funder or change maker? Why does it matter that this change happens? What problem is it helping to solve at a larger level? And what is the long-term value of the work? Now, I was having a conversation with one organization that was working in a community that has persistent housing and homelessness challenges. And around those housing and homelessness challenges, there's a recognition that there needs to be a set of wraparound supports for it. And traditionally, the kind of civic infrastructure of that community had not engaged substance use prevention, treatment, and organizations to be able to really be partnered in that work, at least not all of them, right? Certainly to some degree, but maybe not necessarily all of them. And the conversation around housing that really resonated with voters in that particular community, and those, in this case, I think it was a county commissioner, really interested in what was going on with voters, then was able to make that connection to an organization that was working on substance use related challenges that could help be a part of the solution for housing. And for those of you who I think in particular work around opioids and who do kind of the treatment and recovery side of things really understand these issues very well. But what was great in this conversation around, and that would fit in this category for step 3, is that the substance use organization was able to position their organization as somebody who provides solutions, we're out there, we recognize that the community is embracing or experiencing challenges around these particular issues. We're problem solvers, and they're going to the authorities in their community to position their organization in that way. So I wanted to share that example with you to always be thinking, how can you position your organization as a solver of a problem that's relevant in your community context? And this goes beyond just the sort of, we all know that, we're kind of, we've lived through, and to some extent still are, an opioid crisis. We've lived through challenges around youth substance use. We know understand these challenges at a national level, but it becomes much more relevant when you can go and talk about a particular housing challenge or homelessness challenge in your community, or a particular issue related to drugs and alcohol in your community. Then it becomes much more real. So we have an example here from Stephanie. It says, we would like the coaches, this is the one for the peer recovery coaches, right? So working alongside people that are ready to enter their substance misuse recovery process, it helps getting them to a treatment center, finding meetings available to a county, getting a birth certificate, license, hygiene products, great examples of things that can be accomplished here, right? And to change environments here and changing data with all these different folks. This is so great. Stephanie, I love how you mentioned at the very end that broad array of people that we can think of as part of the ecosystem that funds an organization. Sometimes we get so laser focused on the specific grant RFP that's out there that we forget that many of these other people and organizations are really, really important. Now, I'm realizing I'm probably running out of time, so Stephanie, we're probably gonna have to wrap it up with yours there. But I love that example because it thinks so expansively about funding. So continue to think about some of these ways. How can you make those connect to costs? Now, so that you all know, in our next meeting, we're gonna have another workshop next week. And in this workshop, we're going to review some case studies of how some prevention organizations, have successfully demonstrated impact to communicate funding. We're also going to talk about how to communicate impact in grant writing, fundraising, and donor engagement, also some public advocacy examples that you can use. And then we're also going to talk about how to connect outcomes to investment through some cost benefit analyses. And I'll give you some ideas on how to do this using AI to help you out. And lastly, we'll tie some outcomes in the community level impact to drive funding. So it will be here next week. So you may have already gotten a chance to register on it. It's pretty much the same link that you did for this one. And we would love to have you there as well. That'll be next Thursday, I believe, at noon. So come join us at the next workshop. So the next steps for you, review the scorecard, take a look at those results again, maybe share it with somebody on your team and your organization. Use this build a bridge activity with your team and try to figure out how you can make that kind of connection between those three things. And of course, attend next week's webinar. So thank you all so much for your time, and I'll pause here for questions and turn it over to the PTTC team as we wrap up.